Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode number 271 of the Ask Dr. Angela podcast. I got to tell you, I am just kicked today. I was on call yesterday, and, my calls are typically a 24-hour span, and, I hit the ground running. Yesterday at 7 a.m., I got my usual checkout, which is when my colleague who was previously on call gives me either a text message or a phone call and lets me know kind of the lay of the land. So no surprises here. There was someone actively laboring, and so that meant, okay, no time for morning shenanigans. My usual morning shenanigans are, figuring out what I'm going to post on my social media, preparing my daughter for school. I love being able to take her to school. That's one of my small joys in life. And figuring out what fashion I'm going to throw on in the office. But needless to say, since I was going to the hospital, it was the traditional hospital blues, which are like ever so boring. So I run into the hospital and I introduce myself to the laboring mom-to-be. And lo and behold, she's like, first time mom, first pregnancy, and she's like moving and grooving. The thing that I will tell you about labor is it is unpredictable at best. I mean, some might assume because this was this woman's first baby that she would be in labor forever. So not the case. I think she maybe pushed for 45 minutes and she delivered a viable, beautiful, bouncing baby boy. I mean, you cannot start your day any better than that. It doesn't get any better than that. So in the interim, I finish the delivery, run to my office, and I see patients. Now, the good thing about being me is that people absolutely love me. And the reason that I mention that is I was late to the office. I was like almost 2 hours late to the office. And do you think that any of my patients opted to see another physician? No. They were like, no, we will wait for Dr. Angela. And, needless to say, I'm like completely flattered. And so I saw my patients in the office, and then I, did my miscellaneous tasks and chores, which usually are returning phone calls, reviewing charts, signing off on labs, the whole thing, this life as an OBGYN. And then it just, goes on and on and on. I did a delivery at about 3 this morning, and just when I thought I was out of the woods, at 6:30, I get a phone call from the resident, and, they say, Dr. Angela, your patient's here. She's in labor. She's like 7 centimeters. Now, clearly, I thought that my partner that I was going to be signing off in like maybe 30 minutes was going to be able to do this delivery. 15 minutes later, my phone rings again and the resident's like, your patient's complete and she's pushing. So we've gone from like 7 centimeters dilated to complete and pushing in like 15 minutes. And once again, first time mom. So I haul ass, jump in my car, drive to the hospital, which luckily is about 7 minutes from where I live. Get in there, we deliver a baby, everyone's happy, everyone's healthy, and then I sign out, and then I assume my normal mom duties, which are taking my daughter to school, getting my morning workout in, which is a real ball buster. I guess I should say breast buster since women don't have balls. Well, actually we do, but they're vulva, technically. So, now I'm here doing this amazing podcast, and I am so happy to be here. That was like such a mouthful. So, today's topic is really near and dear to my heart. I'm talking about girls' health. And, what I will tell you is big surprise here. No one is ever really excited to come and see me. Who wants to go and see the gynecologist? I mean, I rank right up there with the dentist. And it's like 50-50 with regards to who women prefer to see. OBGYN, dentist. I personally prefer to see the OBGYN. And maybe I'm a little bit biased, but I hate going to the dentist. So I see a lot of young girls. And so you're probably asking, well, Dr. Angela, when is a really good time to bring in my daughter or my young girl to see you? And really what ACOG, which stands for the American College of OBGYN, recommends is that you bring in your daughter for a meet and greet between the ages of 13 and 15. And one of the things that I like to stress is this visit, there is no exam. So we get that right out of the way. And then once I say that, everyone breathes, everyone relaxes, because no one wants those clamps of death or, that big metal thing or, that plastic duck bill, shoved up your hoo-ha, the JJ, whatever you want to call it. So once I alleviate those fears and, tell my young people, there's no exam involved. You're just going to come in, we're going to chit chat, we're going to hang out, and we're just going to spill the tea, sip the tea. What do they say? What does Beyonce say? Queen Bee, she's all about the lemonade. But anyway, the visit with the OBGYN initially is just really a meet and greet, and it's my opportunity to be able to talk to young girls about their bodies, self-image, hygiene, screening guidelines, reasons you would come and see me. We do a full medical history, a family history. We talk about menstrual health, feminine hygiene, screening, which just FYI, pap smears don't start for young girls until they're 21. In people that are sexually active and under the age of 21, we do recommend annual screening for gonorrhea and chlamydia. Why? Because we see the most cases of gonorrhea and chlamydia in the age group of 25 and under. So anyway, we talk about screening guidelines, and then we talk about body image, we talk about body parts. And one of the things that I am increasingly amazed at is just how lacking health education is in schools. I mean, I see a lot of young girls and they don't really know what normal breast or normal vulva are supposed to look like. So as you all know, I'm all over social media, whether it's the YouTube channel, the Instagram, the Twitter, the Facebook, what have you. I'm getting direct messages from all over the place. And social media is a really good venue to reach young people. Why? Young people are on social media all the time. And so, being someone that utilizes social media so much, I happened to come across this organization, Girls Health Ed, and I was completely blown away. I was completely blown away for a couple of reasons. Number one, my PR people have been saying to me, Dr. Angela, you need to find an organization that you're passionate about, that, you can contribute to, that, you can help make a positive, have a positive impact on. And, the thing for me is I never want to half-ass anything. And so for me to really be a part of something, I have to think that it's amazing. And let me tell you, this organization blew me away. I mean, because it's about giving back, reaching back, and helping, young girls and women that are less privileged, may not have access to some of the things that some others may have access to. And it's about empowering and educating. And I'm I am so for that. And so this organization, Girls Health Ed, is just simply amazing. I like what they're doing in the community, and they're making an impact not just nationally, but worldwide. And so, long story short, the founder of this organization, Sarah Hillware, and I connected on social media, and we've been intertwined ever since. I am fortunate enough to have been asked to be a board member for this amazing organization. And today, in light of talking about girls' health education, girls' visits to the OBGYN, and kind of what I do on my end, I thought it would be a really amazing opportunity, if you will, to have Sarah on the podcast so that she can tell us a little bit about Girls Health Ed. So Sarah, if you are there, welcome, and welcome. How are you today?
I'm great. Thank you so much for having me, Dr. Angela. I think it's a really great opportunity for us to connect here on your podcast, Ask Dr. Angela. And I'm super excited to talk about why it matters, to educate girls about their bodies, even before they step foot in an OBGYN. So I'm super excited to be here with you and talking to you and to get the word out.
Sarah, thank you so much for being here. So my first question for you is, how did you even come up with the concept for Girls Health Ed?
So I actually, growing up as a girl, I had quite a few issues with my self-esteem. There was a point where I was overweight. I had a stuttering problem, and I just remember getting my first period and not knowing what was going on. I had actually really been fortunate to have strong female role models who were in my life. I had an aunt who gave me a really great book by an American Girl called The Body Book, and I've read a little bit about that. And I just remember, saying to myself, what about the girls who don't have this book? What about the girls who are going through this, who may not have someone to guide them and show them the way? I remember that morning when I got my period, calling my mom, and she was already at work, and saying, Mom, there's something that's kind of brownish and reddish, and it's in my underwear, and I don't know what it is. I don't know what's going on. And before that, I wasn't really interested in reading the Body Book. But she was just really, almost shocked herself, because I think I was a little bit younger than she was when I got it. I was about 11 and my mom was 16 when she got her first period. And so she expected mine to come a lot later. And so, she instructed me to go into the master bedroom and to get a pad, and that was that from there. And I started really reading this Body Book and telling all my friends about it. And I was just so intrigued with the fact that these things could happen to us, and that no one was talking about it beforehand. And so fast forward to a few years later, maybe not a few, but quite a few years later, when I was studying at the George Washington University, I was studying global public health and international relations, and I actually ended up doing a thesis on adolescent girls' health education and school-based outcomes. And so I was really interested with the literature out there. I wanted to see what was going on, who was talking about this, because I knew that there had to be some link, to puberty and education. And so I really wanted to see, what happens to girls when they get their first periods around the world? What happens to girls who may grow up in societies where this is taboo, or to girls even who grow up in the United States, and they just don't have someone at home to talk to them about this? Or,
Absolutely.
What are we doing in our schools, to expose girls to this? And so I ended up writing that thesis, and here we are. And I've, along the way, uncovered so much about the deficits in our education system when it comes to health education, particularly for girls and young women.
Absolutely. And one of the things that you actually mentioned that I think is a really good point, specifically when you mentioned that you were so much younger than your mom was when she got her period, is that young girls are going through puberty at so much younger than like their parents. And I think it may have something to do with the steroids and all the chemicals that are in the food, but that's like a whole nother conversation. But you're absolutely right. We need to start having these conversations at a much earlier age. And so, being able to name the body parts, as well as being able to appreciate and embrace that which you have, big, small, black, white, green, yellow, there are many different variations of normal. So I think that it's amazing that, you ventured out and you provide this kind of access to girls nation and worldwide, because I have to tell you, as an OBGYN, I see the deficits in learning with, regards to young girls not really knowing what's normal, what's not normal, period hygiene, things that you can use, what's available. It's really quite mind-boggling. So I think that, the platform that you've created is really quite wonderful. So let me ask you this, Sarah. What are some of the core values and curriculum for girls' health ed that you all, and that we, I should say, emphasize?
Right. So before I get into that, I wanted to mention one thing, and that's something that may shock your guests. So only 13 states in the United States mandate health education to be medically accurate. And so that was one thing that I actually uncovered 6 years ago when I founded Girls Health Ed. And so when building this curriculum, I wanted to make sure that we brought in, the best of the best to really help us, build something that was, based on the truth. And that was really based in, medical literature, public health literature, but that was also digestible, and friendly to girls that we work with,
Sure.
who are, they're ranging in age from ages 8 to age 18, right?
Right.
So some of the values, I mentioned to you that I actually founded Girls Health Ed after I wrote this thesis. And so one of the things that I found in doing that research, and I actually did research in rural United States, urban United States, and then I also did two research death studies from Kenya and India. And one of the things that I found across the board was that there were sometimes programs that focused on sex education. There were sometimes programs that focused on maybe nutrition or physical fitness. And then there were some that maybe focused on, puberty and what happens in the body. But there were very few. Back then when I was doing the research, there were none that at least I found that brought all of those things together.
Right. Comprehensive, if you will.
Exactly. So comprehensive health education. And I know growing up, so I grew up in Louisiana, I grew up in the Deep South. I had no health education. My health education was a nun passing around a piece of tape telling us that because the tape didn't stick at the end, that was the analogy for what we'd be like if we had sex before marriage. So that was my version of sex ed.
Wow.
And so yeah, I mean, a lot of kids, around the world are getting that. There's some who are getting some of it, but even then, there's almost nothing, in which girls are being targeted. And what we're finding is that girls are actually falling behind once they reach puberty. So what we really wanted to do is we wanted to use nutrition and physical fitness as an entry point to talk about some of the other things that happen during the body, or happen in the body during puberty.
Right.
And so we actually have 5 modules. We have nutrition, physical fitness, personal care and hygiene, in which we talk about menstruation. We talk about hair growth. We talk about, how to take care of your body from a mental health standpoint.
Right,
as well. We
right.
talk about healthy relationships. And then we have reproductive health, where we, talk about everything from contraception to sexuality. We talk about, HIV prevention, STDs. So it's really head to toe. And our values are that, we come in, we are talking about the whole girl. We want our curriculum to focus on girls' empowerment. But we use that really as an entry point to talk about all the other things that may be uncomfortable.
So I have to tell you, Sarah, I love everything that you just said. And one of the things that I have found to be most impressive about Girls Health Ed, and it's another reason that I was so excited to become a part of this organization, is because, number one, your curriculum and your values are completely comprehensive. And number two, you do focus on the whole girl. But the other thing that I think people would really love to hear is just, about the teaching fellows. And the great thing about that is these teaching fellows are young, they're role models, and they're representative of every girl. There's nothing like seeing someone that looks like you, that's, younger, and being able to receive this information from them. Because one of the barriers, I think, in presenting and talking about, sex education, any kind of thing that is health related is, sometimes the age gap presents a little bit of a barrier, and there's not that same connection. So what you're doing with the fellows and their ability to get into these schools and into these cities and relate to the kids is like hands down amazing.
So it's great that you mentioned that. Our Teaching Fellow program is something that we're really proud of, and it's something that differentiates Girls Health Ed from other organizations who may be now doing similar work. And so what we've actually done is, as I mentioned, we created a curriculum that's 5 modules. And those modules are taught in the school. So either during school time or after school. Sometimes we also work in community centers, and as I mentioned, we work both in the U.S. and internationally in Kenya. So the model varies a little bit based on where we are, but the delivery is very similar. So teaching fellows who are, as you mentioned, young women, oftentimes they're in their 20s, 30s, 40s, and they've got background in public health, or they are school teachers, or they are, nurses. Sometimes we've had med students, we've had people getting their MPH, we've had folks who are working on their masters in education, and then also college students, so college juniors and seniors and things like that, who are really interested in giving back. And so we train them on our curriculum. And so we probably have about 60, maybe even more at this point, teaching fellows who've been trained on the Girls Health Ed curriculum. And then what we do is we actually match each teaching fellow with a group of girls, so at a school or community center, what have you. And then they stay with that group of girls throughout the entire workshop series. So throughout all of those 5 modules, all of those 5 sessions. And it's really great because you really see the girls and the teaching fellows form a mentorship relationship. And the reason that we match 1 or 2 teaching fellows with these group of girls is because we really want them to feel comfortable enough to ask questions about their bodies.
Right.
Sometimes we even have girls who disclose situations at home. Maybe there are situations of abuse. Maybe they're not really getting what they need in the home, and the teaching fellow is sometimes the first line of defense for that. So they all also go through mandated reporter training, depending on where the teaching fellow is, in the country. For example, in the U.S. and D.C., there's a mandated reporter training that each volunteer has to go through before they're able to enter the school, and that really helps to make sure that if there's anything that a girl reports while in our program, that teaching fellow is trained to be able to handle that.
Sure.
And so it's really great, and it's really kind of an entry point to help the girls, develop role models, and to have someone to look up to, who's confident, who's gone through what they are currently going through.
Absolutely.
But who isn't too far removed to where they can't be relatable.
Exactly. So let me ask you this, Sarah. I mean, Girls Health Ed is just doing it and doing it and doing it very well. Please let my listeners know about how successful Girls Health Ed has been, specifically over the course of the past year. How many girls have we reached thus far, and what are we aiming to reach in the near future?
Yeah, so thank you so much for asking that. We actually have a campaign coming up, and it's an online crowdfunding campaign. We hope that everyone will participate. And so Girls Health Ed, as I mentioned, will be around for 6 years this year. So we were founded in 2012. And, Girls Health Ed at this point, we are in multiple cities throughout the U.S. So we're in D.C., we're in New York City, we're in Los Angeles. And this summer, we're hoping to do a pilot in New Orleans, which is, pretty close to where I grew up.
Sure.
And also the highest HIV/AIDS rates in the world, and also teen pregnancy. And so we're hoping to continue with our expansion. So Dr. Angela, 50% of our programs are actually held internationally. So we've served up to 2,000 girls, as I mentioned, actually probably even more. I think this year it'll be about 2,200 girls that we've served. And so 50% of that has actually been in Kenya. So we've actually served girls in both the Kibera slums and also in Kagelo. Kagelo is a little bit more rural. Kibera is more urban.
Sure.
But many issues are the same. And so in a lot of our workshops, we're actually providing free sanitary products. Many of those are reusable, and those are actually provided in kits. And those kits are personal care kits for the girls. One of the really interesting things that, I didn't even know before we went to Kenya is that some of the girls in the rural areas have never even had access to a mirror.
Wow.
So
yeah.
imagine never seeing yourself, never being able, to kind of have that, that really physical self-image. So, part of what's in that personal care kit is a mirror so that girls can, kind of be able to see themselves and know that they're, beautiful
Right.
and confident and strong, and amazing. So we're really hoping to continue to expand. We've received requests to expand, within East Africa, to many other countries. We actually have also received partnership requests to expand to Afghanistan. Also more areas within the U.S. In Chicago, in St. Louis. So we're really hoping to use this campaign to be able to scale up our efforts. We won't stop until we've reached every girl who needs this information. And Dr. Angela, I think one important thing to mention is that, even though Girls Health Ed, as you said, has, over these past 6 years, we've really become, sort of fine-tuned in what we do.
Mm-hmm.
But the thing is that we want to make sure that we're able to reach every girl, and as many as we can, in as short a time frame as we can. So we actually work through partnerships. And so it's really important for us to make sure that our model is scalable, and that even if we don't have direct access to girls, we can actually train teaching fellows, and we can actually work through partnerships to get the information
Absolutely.
out there, because we never want that to be an issue. So we've got many partners, around the country, around the globe. And we're really looking with this campaign that we've got coming up on June 12th, to be able to ramp up those partnerships, to be able to continue to expand, to reach more girls. Our goal is to reach 5,000 girls, by the end of 2020. So
Mm-hmm.
we've got a lot of work to do, and we really hope that all your listeners will join us on this journey to be able to meet those goals.
So, Sarah, please tell all of my listeners how they can make a contribution.
So right now, Girls Health Ed has got a page on our website. So if you just go to girlshealthed.org, that's Girls Health Ed, so that's ed.org, and just click the button that says donate. It'll take you right there, and you can donate straight through PayPal. We've got a secure link there. You can use your credit card, you can use check, or what have you. And then we're also going to be out there soliciting pledges, leading up to June 12th. So we hope that folks will stay on top of our website, follow us on social media as well, to start, learning about this campaign that we're doing on June 12th. And we're really hoping that everyone can give on the day, because it's really important. So one thing that I think is exciting is that we have a matching donor who's going to match up to $3,000 of every dollar that we raise. So
Nice.
if you give to us on June 12th, it's awesome.
So, Sarah,
if you
do they
give us
need
on
to
June
give
12th,
on June 12th, on the actual June 12th date?
We're asking folks to give on June 12th, because if you give on June 12th, if you give $25, it automatically turns into $50. And if you give, $5, it automatically turns into $10. So we're asking folks to give on June 12th. But in the meantime, you can definitely, start donating on our website. All of the funds, as of today, will go towards the campaign. But June 12th is that day where we're asking everyone to give on our campaign page. But leading up to that, please feel free to go to girlshealthed.org and go to donate now, because we are starting to count those funds towards that June 12th campaign as well.
Absolutely. So thank you so much for that point of clarification, because now I know to give my donation on June 12th so that we get the most bang for our buck. Sarah, I would really just like to say to you, thank you so much for being a guest on the podcast. One of the things that I value most is educating, and through educating, you empower. And as my one of my favorite childhood soldiers, G.I. Joe, always says, knowing is half the battle. So in closing,
Absolutely.
I want to just say thank you so much again. I hope that all of my listeners, please make a contribution to Girls Health Ed. It is an organization that is very near and dear to my heart. And, anything that is going to help promote empowerment and education of women worldwide is well worth your contribution and your energies. In closing, as I always do, I thank you so much for listening. I'm going to leave you with this thought. My wife actually said this to me when we were in the gym this morning. Ange, nothing beats a try. And the other thing that I'm going to tell you is fail until you don't do it anymore. All right?
Yeah.
So until next time, look better, feel better, be better. Looking forward to reconnecting on the next episode of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.